Hi guys, it's Dr. Kelly Lipp here, and I'm going to talk about front teeth or anterior crossbites. For an ideal bite, the top front teeth come outside of the bottom front teeth when biting together, as you can see here. In a front tooth or anterior crossbite, one or more of the bottom teeth come in front of the top teeth when biting together, as you can see here. When we notice this, it's important to correct for three main reasons. This type of bite is considered a traumatic bite, meaning that the incorrect relationship can cause recession or downward migration of the gum tissue here. It can cause wear or chipping of the front teeth, and it can also affect or restrict lower jaw growth. And lastly, it can affect the appearance of your child's smile. So how do we treat anterior crossbites? If the crossbite is mild, meaning that it only involves a few teeth and there's enough room for the front tooth to move forward, we can fix it in our office with a few methods. These methods include the popsicle stick method, the ramp method, or the spring-loaded retainer method. The doctor will evaluate your child and recommend any of these treatments if they're indicated. If the crossbite is moderate to severe, meaning that it involves multiple teeth, or if the teeth are crowded in addition to having a crossbite, then we will not treat it here in our office. Instead, we'll refer you to an orthodontist for an evaluation. But before we send you to an orthodontist, first we have to wait until enough permanent teeth are in. Our office will wait until all 4 permanent front teeth are in the mouth, and this is usually not until around age 10 years old. It's also important to note that if the crossbite is present with baby teeth, it is especially important to wait, as sometimes these bites can self-correct, meaning that when the new permanent tooth comes in, it erupts into the appropriate biting relationship. If the crossbite is very mild and the tooth in question is still coming in, we can attempt the popsicle stick method. In this method, we will have your child bite on a popsicle stick for 20-minute intervals to create a wedging effect. This force can sometimes be enough to correct the crossbite. If it's beyond attempting the popsicle stick method, we can attempt the ramp method. This is where we put a white filling material on the bottom tooth to create the same wedging effect. You can see that white material right here. This is more effective than the popsicle stick method, as the ramp is permanently adhered to the tooth. Typically, after we put the ramp on the tooth, it takes about 1 to 2 weeks for the crossbite to correct. Lastly, if the tooth requires more significant movement, we can also try the spring-loaded retainer method. In this method, we will have your child wear a retainer. On the retainer, behind the teeth and crossbite, there's a little spring that you can see here. This spring will push the tooth forward into the appropriate location. If we see that your child has an anterior tooth crossbite, we'll point it out to you and discuss all of your treatment options.